Hello friends, welcome you all to my channel Housekeeping Hospitality. And today's topic is a very important topic where we'll discuss about hospitality industry versus COVID-19. That is a proverb, prevention is better than cure. So we'll discuss all the necessary steps which we should take to control this COVID-19 coronavirus disease by spreading among our staff, colleague and guest. So what are these? We'll discuss in this video. Number one, we should know what is coronavirus. Coronavirus are a large group of viruses which may cause illness in animal or humans. In humans, several coronavirus are known to cause respiratory infection ranging from the common cold to more severe disease such as Middle East respiratory syndrome, MERS, MERS, and severe acute respiratory syndromes, SARS. The most recently discovered coronavirus caused coronavirus disease that's called COVID-19. We are struggling with COVID-19 nowadays. So what is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. The new virus and disease was unknown before the outbreak began in Wuhan, China in December 2019. That's why it is called novel new coronavirus COVID-19. It is an infectious condition, which means it can be spread directly or indirectly from one person to another. It involves the upper respiratory tract, nose, throat, airways, lungs, and cause respiratory infection, thereby causing difficulty in breathing. So these are coronavirus symptoms. What are the common symptoms? Common symptoms: cough, fever, headache, tiredness, chills, sweat, aches, difficulty breathing. Some people may be even asymptomatic and they may not develop any symptom even after infection. Older people and those who underlying medical problem like high blood pressure, heart problems or diabetes are more likely to develop serious illness. Anyone with symptoms like fever, cough and difficulty in breathing should seek medical advice ASAP. So what are the precautionary measures we have to take in hospitality industry, in hotel industry, in hospitals and all offices? Clean your hand and often during the day. Do not touch your face, eye, nose or mouth. Use tissue while touching surface and elbow to open doors. Use soap and water or an alcohol based hand sanitizer, and restrict touching any surface unless it is unavoidable. After returning home, wash your hand, face and any exposed skin properly. If you have infected or you are came in contact with any infected person, then we have to wear a mask at all times whenever we are going outside your home, while traveling to work, while at store or hotel or hospital, or while stepping out of your house or essential purpose. Then you have to cover your nose and mouth with a tissue or with inside of your elbow when you cough or sneeze. Do not cough or sneeze outside or anywhere on the palm. Also you have to sneeze and cough in your elbow only and only. You have to remember all these points. Then you have to maintain a social distance of at least 3 feet from others. Then avoid inviting guests, customer, visitors, vendors, contractors to your home or office or anywhere else. And you have to avoid public gatherings in your home also, and you should not be part of that. Avoid visiting crowded areas like malls, markets or restaurants, and try to isolate yourself. And the most important thing is that social distancing you have to maintain 3 feet. Then avoid traveling also. You have to suspend all non-essential travels and proper quarantine protocols if you travel to any contaminated or containment or hotspot regions. And most important thing is that exercise strict caution in making travel plan to any region. And avoid traveling in crowded public transport and shared public transport such as trains, buses, share autos and taxis. You have to travel non-essential travels. Then our You have to be stay hydrated. Drink up to 8 to 10 glasses of water every day to stay hydrated. Try drinking warm water throughout the day, and include green vegetable, fresh fruits and nuts in your daily diet. And most importantly, practice exercise, yoga, pranayama or meditation for 30 minutes daily without fail. And most importantly, you have to sleep well for at least quality 7 to 8 hours of sleep, which develop immune system in your body to fight COVID-19. Then last but not the least, you have to stay home if you are feeling unwell, and keep your mask until you return home. Carry your own bags while shopping. Do not take other bag, or do not take the bags from the shop. Use digital mode of payment and avoid cash transaction while traveling, shopping, etc. So friends, these are the precautionary measures you have to take during this COVID-19 in hospitality industry, in hotels, hospitals, malls, offices, home, everywhere. And what are the things you will be undergoing? You will be check your temperature before you start your work, and you should have Arogya Setu app installed in your phone in you are in India. Do not report to work if you feel fever and symptoms of flu. Always carry an alcohol-based hand sanitizer in your pocket, and make sure you do not step out of your home without a mask, and carry food from home and avoid outside food. So please see all these things in your screen, and these are the very, very important things if you are going to fight COVID-19. Avoid using public transport, especially during peak traffic hours. Wear a mask and follow social distancing in public transport and staff transport if applicable. And carpool, preferably with a few colleagues. And you should drive your own vehicle to work. Travel solo if you are in green, orange, hotspot zone, and hiring a cab. And this is your future is depend upon the precautionary measure what you are taking during COVID-19. You will be checked for body temperature with thermal guns. Body temperature should be below 38 degree or 100.4 degree Fahrenheit. Anyone who has a high temperature or flu-like symptoms will be asked to return home. A mask is a must for safety, hence no one will be allowed to enter the store or hotel or hospital without a mask. Please ensure to sanitize your hand before entering the store, mall, office or hotel or hospital, anywhere else you are going. Social distancing of at least 1.5 meter must be maintained between all individuals while returning the store, entering the store or offices or anywhere else. And download the Arogya Setu app if you are in India, and self-assessment, take the self-assessment. Only those who have green status, then only they will be entered in the hotel, hospital or stores or offices. A self-declaration of health condition will be compulsory, captured every 3 days through your whatever app your company is providing, that need to be provided. And your attendance should be these are precautionary measures. Should biometric attendance through fingerprint will be discontinued for the notice. It should be in your offices, and your attendance should be taken with any app which is carrying like alt work app. And then manual attendance shall be maintained if the app is not working. So all these measures need to be taken if you are going to fight with COVID-19. There should not be any personal touch with anybody else. And after entering the workplace, you should wash your hands well and repeat frequently. All individuals must wear mask properly and ensure that they cover their mouth and nose completely. Team members at food section, beauty counters, cash deals, and if you are in customer service desk or security or luggage, you should definitely have hand gloves. Dedicated dustbins need to be provided for proper use of mask and gloves. Avoid using lifts and use the staircase instead in case lift need to be. So these are the precautionary measures. Maintain social distancing at least 1 to 2 meters with colleague and customers or guests. Avoid queue at restrooms. Frequently sanitize your hands using sanitizer available at the store, or hotel, or mall, or hospitals. Only non-contract form of greeting to be practiced with the colleague and customer. Stick to your designated work area and do not gather in common areas such as back rooms, lockers, fun zones, anywhere else. So these slides are applicable for hotel, hospital, stores, offices, everywhere. Cut down on use of hard copy files, paper, and opt for soft copies and digital correspondence. Use gloves if paper is unavailable. Complete the COVID-19 guidelines SOPs training assigned to you by the company. If you have symptoms like fever, cough, or any difficulty in breathing, inform your store people, officer, store manager, and seek medical attention. If you notice a team member with symptoms, avoid contact with them and inform your store people, officer. And food dining area, all store members are encouraged to bring food from home, eat at desk whenever possible, and avoid sharing food. Food delivery from outside should be avoided. If food delivery is required, contactless delivery should be opted. Avoid going outside the workplace for tea or smoke. And if you eat at the pantry, cafeteria, fun zone, or any back area, maintain social distancing while dining by sitting alternatively and not face to face with anyone. Lunch break to be staggered to avoid crowding. So if you are delivering food also in anybody's home, social distancing need to maintain. If you are in hotel industry, ensure customer guest maintain social distancing while waiting in the queue outside the store or hotel, as well as inside the store or mall or hotel. Use queue manager stickers or chalk to denote the space customers need to be stand. Recommended distance is 6 feet. Regulate the number of customer who enter the store, hotel. Avoid overcrowding. Maximum customer or guest occupancy inside a store should be decided based on the size of the store or a hotel. Ensure safe distance of 1.5 meter between the customer need to be manned. Ensure that all customers or guests are wearing face masks. In case of customer or guests do not have one, request them to politely buy one from everyone's safety before entering. The temperature need to be taken. This should be below 30 degree or 100 degree Fahrenheit. And ensure that a sanitizer distribution is placed in the entrance of the hotel or mall or offices. And assure customer about the hygiene, sanitation, and other precautionary measures taken by the store or hotel or hospital to ensure safe journey. A number of person handling food item will be limited. All individual handling food items must compulsorily sanitize their hand and wear hand gloves. Loose commodities should be pre-packed to avoid contamination. Team members must assist common in packing and picking the product to reduce contamination. If feasible, a team member wearing gloves should be deployed at the chillers which have doors, so that only he can open the chillers doors and help the customer with their product. Instead, every customer open the chiller. So billing, we'll discuss about billings, and floor marking at the tiles must be made to ensure social distancing while checking out or billing the customer. Cashier and baggers at cash tills must wear face mask and gloves. Ensure to record customer mobile number at each cash till in a POS. An active MPOS to help speedy checkout of less items. This is same applicable in hotel industry, hospitals, offices, and shops also, wherever we are going. And encourage customer to make digital payments through cards and digital wallet instead of cash transaction. Encourage use of tap features to avoid punching in their PIN numbers. Focus on contactless billing by extending a tray to receive or return card or cash for payments. And EDC and POS machine must be sanitized, cleaned frequently by the housekeeping staff in hotel, hospital, malls, offices, anywhere else. Friends, these are the precautionary measures you have to take to fight COVID-19, what we are dealing with right now. And during delivery, the riders must wear face masks and gloves, and all times need to avoid contact with any other surface as much as possible. Whenever possible, an elbow must be used to press elevator button, open door or ring bell. They must practice social distancing from 3 to 6 feet while receiving or delivering the food to the customer or guest. After ringing the doorbell, the package must be left at the doorstep, leaving space for the door to open, and the rider must step 6 feet away from the customer or guest to receive their order. So entry and exit points in the hotel and offices, bill punching, checking or carry bag, post purchase must be, or this should not be done, this should be exempted. Team member at security and baggage counter must wear face mask and gloves. Frisking and entry and exit must be discontinued for further notice. If all security guards still need to check, customer or team members should be asked to pull out their pockets, sew their belts, pull up their pants or expose the ankles, and other open their bags to show the contents